Thanks for joining us for this COVID-19 briefing for Monday, August 16th. Today's numbers, these are system-wide numbers for Forest General Hospital and Merit Health Wesley. In the hospital, as of this morning, 172 patients with COVID. Out of those 172, 44 are in the ICU. We continue to set records, and not in a good way. I again want to point this out, and I'm going to point it out for the next few briefings. Look at where we were in that spike in July, August of last year, and then the spike that we had between Thanksgiving and New Year's, the end of last year, beginning of this year, and then look where we're at now. And so during those first two spikes, we peaked at 117, and now we're well over 170 with no real curve in sight. And so I think that's important to know that and to see kind of what's driving those. And as we can see in this next slide, a lot of that's coming from unvaccinated people. Of the 172 hospitalized, only 25 were fully vaccinated. Of the 44 in the ICU, only 3 were fully vaccinated. And of the 19 on ventilators this morning, only 3 were fully vaccinated. This is certainly a thing that we have to look at, understanding that unvaccinated people are the ones that are ending up, for the most part, in the hospital. Deaths, sadly, we have 3 new deaths in Forest County to report since Friday's briefing, which brings its total to 172. We send our thoughts and condolences to those families, as well as an additional 95 total deaths in Lamar County. New cases, the Department of Health reports Monday cases. They give you 3-day totals for Saturday, Sunday, and Monday. That number is 310 for Forest County over the weekend, Lamar County 244 over the weekend. The inside 14-day number, this is the number of people who have received their positive diagnosis in the last 14 days. In Forest County, that number now stands at 1,722. In Lamar County, 1,324. One thing I want to mention about this, as you see that total, 3,046, even in the previous spikes last summer, which between Thanksgiving and New Year's, the total we got for the entire metro area, the peak was around 1,300, which you can see that both counties have cleared those individually now. And now 3,046 potentially active cases in our community. Just compared to a week ago, we were for the metro area, it's Forest and Lamar counties, we were only at 2,346 inside 14 days. The number has increased by almost 700 over the course of a week. And in hospitalizations, a similar not so great story, going from 152 last Monday to 172 today, and then 33 last Monday in the ICU to 44 today. Vaccination rates, again, we're seeing some positive traction here. We just wish it would come a little faster. 29% of almost 29% of Forest County is now fully vaccinated. We have another 6% that is 1 dose. We've seen an increase of 386 people in Forest County get their shots since Friday. In Lamar County, an even better story. Lamar County has now cleared 50% in terms of people who are fully vaccinated or at least have 1 dose. You're seeing that 1 dose percentage continue to rise, even while it takes a few weeks for the fully vaccinated number to come with it. But getting people in the door to get that first shot is a positive sign. 486 additional people have gone to get their shot from Lamar County since Friday. If you're looking for kind of where you should go to possibly get a vaccine, Vaccinesgov Search is a good tool to use to find not only hospitals, clinics, but also pharmacies like Walgreens and CVS and other areas that will give you a COVID shot. And some of these you can even make an appointment for your family. And so I encourage you, if you're looking for a place to go get a shot, Vaccines.gov/search. Bottom line here, the Delta variant is spreading quickly. It's spreading faster than at any point during this pandemic before. And I realize 17 months in, people have gotten tired of it. People thought it was over with when the vaccines first came out. And that's not the case anymore. We're seeing both in hospitalizations, we've long gone past our previous peak. Our inside 14-day number, long past its previous peak. I mean, this thing is going quickly. And there's some things that we can recommend in terms of wearing masks and vaccines, and we can preach these things. However, the bottom line is, it is smart, responsible behavior, individual, personal responsibility to protect yourself and others. We can give recommendations. We can ask you to wear your mask, and whether you're in work or church or out shopping. But for example, with children right now, we're seeing more children diagnosed than at any point during the pandemic, each of the last 2 or 3 weeks. And now that our school districts have implemented mask mandates, whether both public and private schools, what we're finding out from our school administrators is a lot of these infections are happening at weekend social gatherings. And so ask yourself, while we're in the middle of this spike, Should we be hosting a birthday party? Should we be hosting a senior party? And if we have to do those things, and people are coming indoors and they're in close proximity, are we having the people who attend those wear masks? Each of us has a responsibility to use our best judgment for ourselves and those people that we have influence over to do the right thing. And we encourage you to do smart, responsible things individually and collectively to try and get this thing leveled off. And there are ways that we talk about to stay safe. First of all, get vaccinated. It's our number one message. It's the number one message our healthcare providers, when we talk to them on almost a daily basis, want us to tell you is go and get your shot. Second thing is wear a mask. CDC now recommends, whether you're vaccinated or not, to wear a mask indoors or when you're around other people. You should do that. Avoid large gatherings. Right now, as much as we've missed being around and we're sort of getting in a routine going out again, that's a really bad idea right now when 3,000 people are potentially infected in our metro area. And then finally, if you do test positive for COVID, ask about the need and the availability of monoclonal antibody therapy. If you were in that category of the last 17 months about vulnerable populations, whether it's because of your age or some underlying conditions, when you find out that you have COVID, if you test positive, you need to immediately ask, is this available for me? Do I qualify for this, and where can I get it? Because if you get it early enough in your diagnosis, there is a lot of data that says that it starts to, it keeps you from getting seriously ill. It can keep you out of the hospital. Now, it's not always the case, but it is the one reliable therapeutic that we do have to give people a fighting chance. Testing, again, Forest County Health Department has Monday through Friday. They have rapid and PCR testing. Those slots do, however, book up quickly. But go to covidschedule.umc.edu. On Wednesdays and Saturdays, we have PCR testing, not rapid testing, at CE Roy Community Center. We had such demand on Saturday, we opened it up on Sunday last week because of the demand and trying to shift people away from the ER, which goes to our last thing that the hospitals wanted to let you know. Testing is not a reason to go to the emergency room. Right now, with hospital beds, acute beds in short supply, and in ICU beds in short supply, a lot of people are hanging out in the ER right now. They're holding people in ER rooms until they can find them a bed on the main floor. It's important that if you have to get tested and you're not just too far gone and you're not really, really sick, that you try to go get tested somewhere else. And again, at that point, if you're in one of those categories, pre-existing condition or 65 or older, then at that point you should ask if you qualify for monoclonal antibody therapy. But if you're just going to get a test, please do not go to the emergency room. There are other options available to you. And finally, our act of courage. Throughout this pandemic, we've had community partners, organizations, businesses, churches who have gone above and beyond to meet some need in our community. And that could be masks, that could be giving food packages away during the height of the pandemic, or especially right now, making their church a vaccination site. Mount Olive Baptist Church did that over the weekend. We appreciate Pastor Siggers and his team for doing that. We had 50 people, which is a really big number for a non-medical site, a vaccination clinic, who came out and either got their first shot or got a J&J shot. We look forward to continuing to see these pop up in our community. We appreciate the outreach that the church did ahead of time to get people there, let people know about it. As we start the week, remember to wash your hands, take care of yourself, wear a mask if you're around others. Please get your vaccine. Most of all, be kind. Have a great rest of the evening.